Dr. Clint Whittler, who is a chiropractor extraordinaire, and we're going to get into all of that. But before we do, it's time for some rapid fire. Word on the street is, according to your website, you played rugby.
I did.
But you're from the U.S. Mm-hmm. So I want to know, why rugby and not football?
Well, I actually was going to college to play football.
Okay.
Short version, I didn't make the best decision as a senior. Signed with 2 schools.
Oh.
So didn't realize you can do that at the time. And yeah, just changed my mind. And so I had to get redshirt my first year.
Yeah.
And then I found rugby and just
fell in love with it.
Yeah.
Do you wear, isn't rugby, less gear? Isn't there less, protective gear, or no?
Pretty minimal. You're wearing shorts and a shirt. That's pretty much it.
So it's not like you have shoulder pads and, you have a helmet, right, or no?
Some people can wear what's called scrum cap. It's
Yeah.
very minimal padding. Same for the shoulders, but most people don't wear them.
My cousin, she played rugby, and she, broke her neck. Yeah, anyways. And she's fine. But I'm just saying, I always think rugby's wow, so aggressive. So what positions did you play? Or what, in rugby? Do they have, I don't know anything about rugby, okay? So I'm just telling you.
So it's unique at that, you're playing offense and defense. So positions kind of cross over. So if you use football references,
okay.
My position was a fullback.
Okay.
But
got it.
Wouldn't be the football fullback.
Yeah.
It would be if you put a receiver, a strong safety, a punt returner, returner, and the kicker.
You're busy.
Yeah.
You're a busy person out there. Do you still play now or no? Is there rugby in Knoxville?
There is, and there's some good rugby.
Really?
But the last season, I think, is going to be my last. I've also retired 3 times, so we'll see. You
don't have to commit. You can change your mind at any time.
Either wearing the Knoxville rugby hat.
I wonder what that was. Okay, that's awesome. So you went to Arkansas State, is that right?
Mm-hmm.
But I see that you have a Tennessee orange here.
Yeah, so especially undergrad rugby, UT was our rival at the time, which is kind of unique. So when I first moved here and sent me wearing a hat to one of my friends that went to school here, he was did not believe it.
He's what happened to this man? Is this my same friend? Oh my god. Okay, so as an athlete yourself, endurance training or strength training? What are you picking?
To be fair, it's usually a combination of both.
Okay. Is that what you do now? What do you do now?
So it goes in waves. I change, but right now, mostly biking, swimming, CrossFit. Okay. Or technically, going to South Landing Fitness now.
Oh, yeah.
Love their programming.
Okay, I've been once or twice. And I was training for an Ironman for a while, so there was no time for additional anything when you train for an Ironman, but I'm I need to get down to South Landing. Okay, you said swimming. So I'm curious. You live in South Knox. Your office is in Powell. Where do you swim?
Fort Dickerson.
Really? Do you?
Yeah, I do like it a lot. I used to.
Do you go in the morning or when are you going?
Usually evenings.
Okay.
And then weekends, just try to find the time where it's not as busy. But
I've not been over there since they've, reopened or whatever.
They did a good job.
Okay.
It's a lot cleaner than it was before, and then
Yeah, my husband's it's dirty in there, but he's old South Knox, old school, so he's because I will swim at the Y, but
okay.
God, anyways. Okay, let's talk business. So you're a chiropractor.
I am.
Tell us how you got into that. How you got into chiropractic. What's your story there?
I'll try to do a shortened version.
Yeah.
I've always been under some kind of chiropractic care.
Yeah.
I think most impactful when I was 17, 18, I had a pretty bad ski fall, and I broke 2 areas in my low back. So most of my recommendations were to tell me you need to get surgery if you basically not play sports, and went through a different route.
Yeah.
I was able to rehab back, let it heal, and through basically not having surgery.
Yeah.
And then from there, had a full career in rugby, and so that kind of impacted me there. And then from then on, it was more helping with sports, performance, preventing injuries. So it's at different parts of my life, it's done different things for me.
Yeah, that's cool. I grew up with this is gonna sound bad, okay? But I just want you to bust some myths for us because I grew up with this perception that like chiropractic is not real. It's like bad medicine. It's not, like it's not really a doctor, blah, blah, blah. Where do you think that comes from? And like, do you, like, is that just because it's not like, not the system? If people are telling you need surgery when actually you didn't need surgery, like you healed, do you know what I mean? Like, what's your take on that?
I feel like it's just a completely different healthcare model. Like,
yeah.
A lot of it is kind of like a vitalistic model where it's like, put the body in the best environment to heal and what will happen. And so like diversity within the chiropractic profession. I mean, there's many different things that put stress on your nervous system. Whether it's like what you're thinking, what your like mechanical stress, like posture habits, stuff like that. I mean, even nutrition, what you're eating. And so like different people kind of gravitate in one of those three realms.
Right. Okay. That makes sense.
I don't know. Does it? Or,
no, I get what you're saying. So like there's a different way to approach like different problems.
Yeah, and so some people just, I mean, because there's so much you can do. Like I think that's why you can see so much difference in which one you go to. Is just because some might focus on different things or try to do it all. Or, but I think what we excel in is more the mechanical stress, fixing the structure, and then like kind of like lifestyle coaching.
Yeah. Okay. Your clients, like, what are their biggest? Are they here to resolve pain? Are they here to keep moving? Like, what is their biggest? What's the commonality of like people that come to see you?
So kind of all of the
everything.
So most come in for like low back, neck pain, headaches.
Yeah.
We do have some that just want to like function and live better and minimize stress off the nervous system. Yeah.
Is it true that like as humans our posture is getting worse because of like cell phones? Is this like a thing? Yeah.
Yeah. I mean globally when looking at, because we use x-rays, full spine to make treatment plans, and you can see like the progression of like how bad posture is getting over time, especially in young kids.
Yeah.
Where they're just like.
Is it because they're like hunched, or is it like just sitting, or is it what is it?
Just repetition over time. You always have gravity pushing down on you, and so if you think of it,
is that what it is? No.
But if you think of like lever effects, I mean, you go to the gym and you only do chest workouts all the time, you're gonna be more dominant this way and a weak back. If all you're doing is this all the time and not doing anything proactive, you're gonna have some kind of imbalance. That over time will lead to a cascade of issues.
A cascade, not just one, a cascade. Yeah, I mean, okay, so when it comes to this idea of like, personally, okay, this is not like a knock on a doctor or whatever. I jacked my knees up pretty bad when I was younger, like skiing. Like you mentioned, skiing is not the devil. I love skiing, but I'm just saying, jacked one of my knees up really bad, and I thought like I'm never gonna be able to run again. Well, now I'm running all the time. So, what is that such a thing? Do you believe like, or how do you know like, oh, you could never run again, or like, is there ever a this is not possible, or is it like no, with treatment, with whatever, like you can get more mobile? I guess is the like broader question, which is pretty broad, but I just want to. I feel like there's always hope. Is that true?
I would like to think so, but like there are certain things that like, I mean. Timeline of how the body's going to heal. And then like I think if you put the best environment to let it heal, it can do some pretty cool things. But there are sometimes it just take work to do, and there's some like I don't know a good answer for this. One I always look is there's hope.
Right? Yeah, there's always some sort of hope. When it comes to like pain, like resolving pain, when is pain like a problem and when is it like, oh, that's sore, or you know what I'm saying? Like, how do you know that your pain is actually like, oh, I need to address that? Or, because like, for example, if I stand up at my desk too long, one side of my body is like, what did you do that for? Then I'm like, it's fine. But I'm like, maybe do I need to get that checked out? Is it misalignment, or is it just like, that's just how my body is, you know?
Well, I mean, pain is kind of just a like, warning signal. Like, if so like chronic pain or those warning signals is usually what you want to look out for. But also be able to listen to your body. It's like a protective state. Like you put your hand on a hot surface.
Right.
It's good.
It's saying, hey, don't do that. So chronic is like you're feeling it all the time, basically.
Yeah, or just something that's very reproducible that not meaning to.
Yeah. Something on your website it says chiropractic biophysics.
Yeah.
It sounds very fancy. So tell us what that is.
It's a technique that we focus on here. It's very much like correcting spinal alignment. So there's like normal curvatures that you have, and like what's called sagittal balance. So like ears over shoulders, shoulders over hips, hips over feet, and then pretty straight from the front. Yeah. When you go outside that normal, it does put more stress on different areas, and that over time can increase rates of degeneration, cause imbalances, which then can affect the nervous system. Yeah. But like, so not everyone's gonna be like perfectly like 40-degree curvatures out there, but within the technique, they've broken down predictable ways to see what people's normal is. Yeah. And then we try to get it close to that as possible.
Right. So does everyone start at their normal and then over time like life and gravity happen, or how does that work?
I mean, something could even be started from like birth processes, but like a lot of times it is, so it's not a good answer for that. So some things are just like congenital, or
just depends.
And a lot of times there could be like something that can happen, whether it's repetition over time or something traumatic, like that cause those shifts.
Yeah. So if I'm thinking like, what can I do? Because you talk also too on your website about like maintenance. Yeah. What are things people can do for like maintenance of like spinal health? Yeah. Or would you call it spinal health, or would you say nervous system health? Like I don't. Which one do you call it?
Hand in hand.
Okay.
Because I mean, your spinal health is what protects your nervous system. Yeah. So it's like keeping that protective. Because if something, imagine if you have inflammation or restriction of a joint. Yeah. And that changes the way the body communicates. It's like it all does go hand in hand. Yeah. So, like, what are things people could do for, like, spinal maintenance, or? Yeah, so one would be getting your spine checked by someone that can detect what's called.
It's someone that knows what they're doing. Yeah. Dr. Clint.
I think a good way to kind of reference it first would be, like, get your spine checked. Yeah. Get it as close to normal as possible. That'd be, like, if you're going to the dentist, like, you shouldn't have, like, sensitivity or pain with your teeth. But, like,
what? No,
right? But it's the same thing with the spine. Like, there shouldn't be, like, each spinal segment should move pretty freely, and then like there shouldn't be pain or sensitivity to that. Yeah. And so if there's something traditionally going on there. Yeah. And then one of the most common things that puts stress continually is like when you basically have too much too little curvature in certain areas. Okay. So like posture.
Okay, so then posture, like if you're, say you work from home, is it better to always be like sitting down, standing up? Should you have a combination? Like, what's your take on like stand-up desk versus like you're sitting on like one of those bouncy balls, or like what is ideal, I guess?
I mean, too much sitting can cause more pressure in there, but it's like ideally having a neutral spine. If you have to be at a desk all the time, like I think standing option would be better than sitting.
And if you're standing, personal question. Do you need to be standing like even footed? Because I find myself, if I'm standing at my desk, I'm always standing on this leg. Okay. Like, I'm like standing like this way. And then an hour in, I'm like, oh my God. Yeah. So that to me would seem not ideal. Like, you should be standing like evenly, right?
I think, yes. Like, putting stress equally would be better than just going shift from side to side. So having some kind of equilibrium. If you're on one side, shifting the other. Right. Just having more of a balance there.
Balance. Okay, what about like when you like, okay, say you're a runner or whatever. How do you like keep your spine healthy through that? Is it stretching? Is it like mobility exercises, which I guess are kind of the same, but like, because I think a lot of times people are like, I don't want to stretch or I don't want to do this. Like, how does that tie into your spine and like your spinal health and maintenance?
So it kind of goes back to the previous question about different things can do, and I think we prescribe exercises and stuff, but like a common one would be like, especially once you reduce restrictions in the spine, it's moving the way it should, just doing like pretty much every range of motion, like in the spine with resistance daily is like a good kind of health maintenance. Yeah. And then going back to that kind of like the cavity reference, it's like first reduce that and then just maintain it. It'd be like brushing your teeth. So finding some kind of routine to get checked, just to prevent things from building up. And then if you think of everything, like if you spend all your time looking down, like at a computer, like do that for multiple hours a day, do something in reverse. So there's certain basically orthotics or devices that you can weigh on. So the first we get x-rays, figure out what's going on, but it's like if if you're spending all your time doing one thing, you need to have a reverse, kind of like we talked about with chest versus back exercises.
That's the chest versus back is so obvious, but I never thought about it that way. Like, but that's interesting. Are there like gimmicks that you're like, oh my gosh, no, do not do that, but it's supposed to be like super helpful? Like for example, and this may be helpful, I don't know, but those things where you hang upside down. Yeah, like what are like things that are helpful versus like that's a complete gimmick, like, you know, whatever.
I mean, I think decompression in the right setting can be beneficial. Sometimes, like when you do the inversion tables, it's not a very specific. So, like if you're trying to get one segment, traditionally those that are like restricted aren't going to move the way you want them to. And other ones are going to get more. So it's like, I think it is a good option. But I mean, it's not for everyone.
Yeah. So talk with a professional.
Mm-hmm.
Okay, what about breathing and like spine health? I asked this because this is a whole long story, but I started working with like this breath coach.
Yeah.
And then he's like, your hips are too tight, your shoulders are too compressed. Like, he's like, you need to work on your posture. So how are breathing and like your spine health aligned?
I mean, if say for example, spending all your breath breathing up into like high lungs versus the stomach, you just think about how many times a day you're constricting those muscles and making them tighter. So like it's very common to have like tight pain or basically tight musculature, pain and stuff. So you're breathing in the belly, like the diaphragmatic breathing is going to stimulate more of what's called your parasympathetic nervous system, and that's more like resting, and relaxation. Okay. But like from a posture standpoint, it does make an effect, but just overall wellness, I would say like being conscious, being able to breathe properly.
Right. Is important.
Right. So.
Yeah. Okay, you have 2 daughters, right?
Mm-hmm.
So as like a chiropractor and a dad, and you're thinking about like their own spinal health or whatever, for other parents, like what are things that like you do to support like their kind of spinal health and maintenance?
I mean, I've been just getting their spine checked from birth, and then like when they basically, when they are out of alignment, we'll adjust. And it's a lot different in kids than it is adults. Yeah. Like very light force, but just.
He said light force.
Yes.
Yes.
But yeah, so I think a lot of it's just teaching them how to take care of themselves.
Yeah.
And like, you know.
Go figure, client.
Right? Yeah. But it's like in terms of posture, like seeing them do something, just kind of being mindful and suggesting other routes or
other options for their
especially
posture.
Because the devices, like it puts so much stress on them. If kids are down like this all the time, it's like it's gonna be a high chance they're gonna have like headaches, neck pain.
Really? So that's like the outcomes of that is the neck pain and the headaches.
So I mean, there's different studies, but there's one where it's like when you've lost the curvature of the neck, so ideal is 42 degrees plus or minus a few, but it's like when you get to 20, it's a 4 times greater chance of having chronic neck pain and headaches. When it goes to 0, it's more like 18 times greater. So it's like you're seeing a lot of kids with complete reverse curves because all they're doing is looking at devices and spending that time, and then it's like it definitely can affect the nervous system. It's like one thing I commonly see is like head forward, loss of curvature, more stress in the upper part of their back, and also having symptoms like asthma, shortness of breath, sort of thing. So you can see that there are parts that are affected by it. It's not saying like because of this it's causing
it's that.
Yeah,
just
like,
this isn't impacted.
If you think of just like if there's more stress on the area, those nerves aren't working as well as they could, and then you see other things happening.
Yeah, that makes sense.
So
that's interesting.
It's not.
Yeah. Okay. So also, if someone wants to like work with you, what happens? Like, are they gonna come here and they're gonna be put in some weird contraption? No, just kidding. Like, what happens? How does it work? Like, what's the process?
All right, so always start with like consultation. Do a full history exam, get full spine X-rays, and figure out kind of what their goals are. And then from there, we'll set a follow-up. We'll bring all that together, kind of to make them a care plan. Figure out kind of like how we can meet their goals and basically put their spine in the best position we can. Yeah. So are most of your people like athletes? Are they older? Are they younger? Like, who all do you see? Everybody? Yeah, everybody. We do have spine. But
if you are a person.
No, so it's really cool because I think like even the atmosphere we've created here, like you can see such a diversity in people that are coming through and kind of working together at the same time.
Yeah.
And so you'll see like a pretty high level athlete, and then someone elderly working on posture.
Right.
And or somebody coming in with like a disc injury, and it's just like every day is different.
Right. Yeah, that's cool. Do most people, it's like a one-off thing, or like depending on what your problem is, you might work with you for months or years? Like, what does that look like?
So usually the first part's more intensive because it's like if there's some kind of imbalance, fixing that. So usually it's 3 to 4 months of working to fix whatever postural issue.
Yeah.
And then from there, we'll take progress, exam, x-rays, see comparison, and then from there, if you think of it kind of like, if you go to the orthodontist, you get this work done initially, then still you want to have general health of your teeth. So
right.
you brush your teeth, do things
right.
to maintain it. Otherwise, it's probably going to
come back. Yeah.
Right. So I usually recommend some type of maintenance on the spine where it's like routine checks, and it's like whether that's coming in every week or every month, like changes on an individual and what their goals are.
Yeah. So do like families see you? Do you see like husbands and wives, like, or is it just anybody really?
It really is. I mean, there's times where family will come in with all their kids and all get checked, and if they need to get adjusted, we'll get them adjusted.
Yeah, that's cool. So getting adjusted.
Yeah.
In my mind, it's like something's cracking and I might be making a noise. So it like, is it scary? Is it bad? Like, I think some people are afraid of like that idea. So like, what exactly is that?
So the sound that comes from that is just gas being released from the joint. So if there's some kind of restriction, like basically scar tissue built up in the joint, we basically find that through the exam, x-rays, and then put specific force into those joints to restore that motion.
Yeah.
Like if you imagine if like a spinal segment's not moving the way it should, it's not getting the nutrition that it needs, and then you'll have compensations that occur from there, and then it can also affect the nerves. So it's like basically the first part would be to restore that motion into that joint.
Yeah.
And that can be done by hand, by instrument. There's many different ways to adjust that.
Yeah.
And so like some will do everything by hand, and you'll hear the popping sounds. And then there'll be others where we use type of like instrumentation. It sounds almost like a woodpecker, where it just like puts individual motion throughout the joints.
Okay. That's cool. Off topic, but on topic. Is there a wrong way to sleep?
I mean, there's like a best way.
Okay, what's the best way?
Basically on your back with some kind of supports for your curvatures in your like back and neck.
Okay.
That would be like the most ideal. The next would be like neutral on your side, where it's like not having your head bending from side to side or forward.
Yeah.
And I'd say like third would be just like however you can sleep. Because sleep is important.
However you can sleep. Wait, how would you sleep so that your low back is like if you're on your back? How would your low back be supported?
We've got
a good mattress. I mean, you know what I mean.
I mean, there's like these little foam inserts that just kind of lightly support that you can put underneath, and so I think they're awesome. There's also pillows that you put where it actually puts the neck curvature in.
Right, where it's supposed to be.
Mm-hmm. There's a lot of importance to having that neck curvature, and especially while sleeping, better airflow.
Right. Okay. Cool. So on your back is the best way, but with support, essentially, like your neck and your.
Yeah, and then there's always like conditions and stuff that like people should
foster or hinder it or whatever. Mm-hmm. Yeah. Okay.
But for like general, without any contraindications to that, I'd say on your back.
Cool. Okay. Is there anything that I haven't asked you that you're like, we did not talk about this, and we need to talk about it?
I can't think of it right now.
Okay. Well, I have another question for you.
What's up?
Okay. I've been in a marathon or two myself. And sometimes by the end of the marathon, there may be a few people that are bent over 90 degrees running. What is happening there? Is that like their legs are tight? Is their spine tight? You know what I'm talking about? Where they can't stand up straight anymore.
I mean...
And they're walking like this. And I just keep thinking, you're going to face plant, man.
Yeah.
Is that a back problem? Or is that a... And you can be like, Haley, this is stupid. I'm not answering this. But I'm always like, what's happening right there?
I'm trying to think. I mean, it could be a few different things, but like, I imagine they just got to the point where they fatigued the muscles.
Yeah.
It's just like everything.
That's the only way to move. Yeah.
And that would be my guess on there, but I don't have a good answer.
I'm always like, that person's like, I'm like, stand up. Stretch or something and stand up. Okay, cool. So, who should call you? Like, if I have a ton of pain, do I go to the doctor or do I go to the chiropractor? Do I call both? Like, what's your advice?
Like that's why we do an exam and stuff. If it's something that like should be going to the hospital or to some other provider, like we'll make recommendations. Right. It kind of depends on the type of pain, but I would say in general, like experiencing like chronic neck pain, headaches, especially if it's tried other things and it's not working, this is a great option to at least figure out what's going on, and then that way we can give some better recommendations if it's something that we can do. And but so I'd say like posture related issues, if it's something that's struggling with postures, spend a lot of time like remote work.
What about driving? What does driving do to you if you're driving a lot? My car will be like, it's time for posture correction, and it turns on and I'm like, oh my god.
Yeah, that's right. Depending on how you're seated, I mean, ideally, you're going to be, so usually one of the things I say when they adjust me for the first time is like, all right, so this is what your posture should feel like. Like, have them kind of inflate their chest, bring their head up over. Like, all right, when you get in your car, go in there, sit like this, adjust your seat so that you're in this position, put your mirrors so like, when you're starting to do this, it reminds you when you look at the mirrors. And so like, I mean, a lot of times, like, we can make changes doing the repetition here, but a lot of it's like lifestyle habits and what you're doing. Like if you don't fix what's causing the issue, it's like still going to be persistent. Right. Yeah. So it's like a lot of what we do too is just trying to like put out enough resources to figure out like what and why reoccurring and figure out how to
and address it. Mm-hmm. This is my own PSA, but I think that anytime you're thinking like, can I keep moving, or I want to keep moving, or whatever, like call somebody, whether that's a chiropractor, a physical therapist, or whatever, or maybe it's a breath coach. I don't know, but my point is like, if you don't, like, to me, being told like, oh, you can never run again, or like you have this chronic back problem or whatever, like I don't think that's necessarily acceptable. So if you're like, should I call Clint, should I not, then I would call him, because if he can't help you, he's gonna know someone that can. But also to me, it's about like wellness is like the goal. And so if you're not feeling well, and maybe it's your spine or whatever, then like it's okay, call, because he can help you. Like that's what he does. So I just want to put out that little, because sometimes I think it's almost more comfortable sometimes to be like, well, this is just how it is. But it doesn't have to be that way. You know what I mean?
And I think that's my favorite part about this is just seeing how people transform, especially over time.
Yeah.
Just like having something that's been going on for a long time, and then like seeing them become more empowered about taking control of basically their lives. Right. And it's just exciting to see like how people change when something's not preventing them from doing the stuff they enjoy. Right.
That's awesome. Very cool. Okay, so if people want to work with you, where should they go? What should they do?
They can book a appointment at knoxvillespine.com.
Literally, it's right there on the website. Mm-hmm. It's right there. Yeah.
865-333-0999. Great staff that will get in the right direction.
Awesome. Cool. Thank you so much, Clint. This was awesome.
Appreciate
I'll see
it.
you on the rugby field. Just kidding. I'm too afraid. Thank you, Clint.